In the past 3 years, health professionals at the Western Regional Hospital have been observing an increase in the number of accident patients needing emergency services. In fact, the Chief of Staff at the Western Regional Hospital, Dr. Rene Godoy, says that the figure has doubled from about 400 consultations to about 800 per month.
We continue to have our challenges, but our population, the young population, bring their own dynamics to it. Our adult population have their hypertensions and heart attacks, and to that we add that we are at the crossroads of two major highways, so that in itself impacts the type of services we provide.
Okay, so what are some of the improvements in terms of the equipment, the facility itself?
Through the partnership that we established, we have gotten monitors, we have gotten defibrillators, machines that shock you back to life. So these are things that were tremendously improved, and now we are going to offer it to the population.
The figures alone is cause for concern for an understaffed hospital. However, an investment of more than $200,000 made possible by the U.S. Embassy in Belize through the Beyond the Horizon project is making it easier for doctors and nurses at the Western Regional Hospital.
What we realized was that the building needed to be connected, and so we were able to get funds through the Beyond the Horizon project for the materials, and the BDF light engineers partnered with the former Beyond the Horizon supervisor who came back to Belize, and they worked shoulder to shoulder on the project to build this beautiful building. And it wasn't only a project with the BDF light engineers or with our military service member, Chief Nemitz, but it was also a partnership with the community.
You've seen the finished work this afternoon. What do you think about it?
I think it's amazing. And as you know, Hipolito, I say that the beauty of the jewel is the people, and our partnerships are the people. And I think this building symbolizes all of that, and what collectively, as a community, what can happen.
And what should happen now is that patients should receive better care.
So we have 2 areas that will do the triage when the patients come in. We have 4 rooms where the patients will be placed at. You can see the nurses have a better monitoring for the patients. And we have 1 area that is a new area that we're doing now, is the OBGYN area, which the women that are pregnant will be there to be triaged before, and if anything is in complication.
So what about staffing? Do you have enough people to man this extension?
With the staffing, we have the normal staffing that we have, but like you, Dr. Godoy mentioned, we still have 2 areas of emergency, this is one, and the other is it's the old area. What they want to do, they want to separate the children or the maternal and child to any other emergency that comes in here. Definitely, we have to look at staffing, but they will give us a proposal.
Reporting for News 5, I am Hipolito Novelo.